Do you have a high LDL on a low-carb keto diet? Should you be worried? Hi, I'm Dr. Eric Westman, and welcome to another Dr. Westman Reacts. If you don't have my top 10 tips on how to start keto right, please look in the description below. Well, the long-awaited results of the beginning of the cholesterol code Dave Feldman lean mass hyperresponder keto diet looking at the coronary arteries is out. You may have seen the presentation by Dr. Budhoff, who is in Los Angeles. It's available online. We'll put a link down below. You may have seen some of the other reports by Dave Feldman and Nick Norwitz, who are people in the study, investigators themselves. But I wanted to give you another view of the results, showing the data itself, putting it into a different context and perspective. Many of my patients, and I know many of you are my patients, have normal LDLs on low-carb diets. In fact, I'd say that's the vast majority. If 2/3 is a vast majority in the political world, it is these days. So most people do not have elevations in LDL cholesterol when they're following a low-carb diet. If you're not starting a diet yet, or you're just curious about it, don't worry. If you were rolling the dice, you know, 2/3 of the time, you would actually have a reduction in your total and LDL cholesterol. You would have a reduction in your triglyceride and an increase in your HDL cholesterol. Most people have a triglyceride and HDL change in the way you want, which is triglyceride going down, HDL going up. But some people, and we don't know the exact percentage, maybe 5% or less, will have an extreme elevation in LDL cholesterol. And if you've watched many videos on this, there's a lot of fear-mongering and a lot of, oh, it's dangerous, you know, you're on the edge of a cliff. No, you're not on an edge of a cliff, but it is elevated and it has lots of doctors worried. I have to say, in my area, my patients tell me other doctors are very concerned for them and even will almost put on thumb screws to get them to take medication for the cholesterol level. Don't worry. So cholesterol is not a disease. You're not on the edge of a cliff dangerous. At best, cholesterol is a predictor or a marker. And if it is causal, it's in a line or a cascade of causality for atherosclerosis. So there's a big difference. Cholesterol is not a disease. Atherosclerosis is the disease you want to prevent. Prevent the beginning or prevent the recurrence. If you have atherosclerosis, also called hardening of the arteries or narrowing of the arteries, in the coronary arteries, this can lead to a heart attack. If you have it in the neck arteries or in the small vessels of the brain, this can cause a stroke. If you have it in the kidneys, it can cause kidney failure. So atherosclerosis is the arterial system-wide disease that you don't want to get. Or if you have it, you don't want to have the progression of it. So Dave Feldman, faced with his own elevated cholesterol level, instead of just listening to most doctors and researchers who said, are you crazy? Just get off that diet. We know it's bad for you anyway. Well, for me, 25 years ago, I was introduced to the idea of a high-fat, low-carb diet and found slowly through the years that it was actually a healthy diet. It reverses obesity, it reverses type 2 diabetes and other metabolic problems. And in some people, it causes this LDL elevation. But if everything else is getting better and there's just this LDL, why would you focus on that? Well, LDL has been sort of the darling causal element in the blood of atherosclerosis for decades. And I say darling because you can treat it with a drug, you can target it, and in some studies, especially if you've had the arterial sclerosis and a heart attack or a stroke before, in some studies it reduces the risk of having that problem again if you target the LDL cholesterol. These are medications, including statin medications, that do have some effect. But it's not a huge effect, but it is an effect. And so this has been the treatable element in a medical world that likes to use medications. Now, I've kind of fallen out of that world. I like to use lifestyle. But back to the study. So Dave, and Dave Feldman, a remarkable story of raising his own money, creating a new foundation to start with this study to address, does an elevated LDL cholesterol in the context of a low-carb keto diet cause the coronary narrowing and atherosclerosis that we're all afraid of? Remember, cholesterol is not a disease, but the coronary atherosclerosis is the disease. So Dave got to scan and talk to people all around the world and found one of the best centers to do a study in LA. Dr. Budhoff is an investigator who has probably one of the best scanners to look at coronary atherosclerosis. So this is not just the coronary calcium score. This is not just looking with ultrasound at arteries. It's actually using a CT scan to look at the inside of the arteries of the heart. And this is exactly what we want to see if it changes on a keto diet with elevated LDLs or with normal LDLs for that matter. But the worry, most of the worry is in people who have these extreme elevations, because the old paradigm of looking at LDL and total cholesterol would say that these people are at highest risk. Now, there's a signal that there may not be risk, because athletes, actually elite athletes, tend to have higher LDL levels, higher LDL and total cholesterols. And so there are some anomalies, or sometimes when the nice, neat pattern doesn't fit. So is it possible that a low-carb keto diet is another pattern that doesn't fit into this LDL story, that increased elevated LDLs will cause atherosclerosis? So, long awaited, because it took a long time to get the money, to get the funding, to get it approved by an IRB, an institutional review board. And I've heard the stories that there are people who said they shouldn't approve this. It was unethical to allow people to have high LDLs. Well, fortunately, the science is actually not clear about this. So I believe it is ethical to study people. In fact, these were people who were going to follow the diet anyway. So it got out of the ethical problems of forcing someone to do a diet that raised their LDL. So you're just following people who've already decided amongst themselves that they're going to follow the low-carb diet, and they've had elevated LDLs. So if you fit a certain pattern of high LDL, high HDL, low triglyceride, you were flown out to LA, the same scanner, to get what was called a CT coronary angiogram. So looking at the arteries themselves. 100 people were all sent out to LA to get the scans. They all were filled in forms, and in a careful process were given these scans, and now are being followed over 1 year to see if they have any progression or change or reduction, for that matter, of the actual coronary artery atherosclerosis. If there's narrowing or plaque buildup, they'll be able to see it. So the score, actually we're looking at the total plaque score, is a matter of taking a picture or a CAT scan of the heart, and people look at 15 different areas of the coronary arteries, and they add up whether they're 0, 1, 2, or 3 score for that artery. So there are 15 areas. A score of 0 would mean there's no plaque among these 15 areas. A score of 45 means that there's severe plaque in every area. And it's important to keep that in mind. The score that we're looking at goes from 0 to 45. So why is this interesting information now? The study's not over. Well, they decided to, like many studies do, publish the baseline data. Here's a presentation with Dr. Budhoff in the little picture there. The reason for putting this information out there is that these people were self-reported to have followed a keto diet for almost 5 years. So the theory is that the LDL, the cholesterol itself, over a period of just a few years, because there were children with familial hyperlipidemia who developed coronary atherosclerosis and even heart attacks after only a few years of really high LDL levels. And remember, if your doctor is afraid and thinks that it's dangerous, then of course it's not dangerous, it might be a risk, but you might think this happens overnight. No, the coronary atherosclerosis process is thought to develop over a period of years, but over 5 years, these people self-reported following keto diets and having high LDLs. And so on the left-hand side, they were able to get 80 people to have this baseline report. And what they also did, which is very clever, as they compared, so that we're not just looking at these scans by themselves, they compared the results to a study that Dr. Butoff was involved in called the Miami Heart Study, where they took these scans in purportedly normal people in Miami. So they were able to compare the scans to normal people to see, well, let's see if the normal Americans, typical American diet, see if there's any difference between the two. So they age and gender matched the two groups, and there's so on the keto side, N equals 80 means 80 people in the study, or 80 participants, 55.5 years of age, and they matched that age group in the Miami Heart Study. If someone was 55 years old in the LMHR study, lean mass hyperresponder, or keto on this slide, then they took someone from the Miami Heart Study of that same age, and they kept matching to get a similar population. One thing that was significantly different here, and I put a circle or a square or a rectangle around it, is the BMI, or body mass index. So the Miami Heart group, the comparison group, were a little heavier. And we do know that the weight confers a little bit of atherosclerosis risk. It's not just cholesterol. There is also the glucose, the diabetes is a big risk factor, smoking, your weight, hypertension, and these were also similar between the groups here. So what was of most interest in this study, of course, is the LDL cholesterol. And for the keto group here, the average was 272, plus or minus 91. So the Miami Heart group, the LDL was 123, half the LDL. And the P over on the far right means the P value, if it's under 0.05 or 0.01, or depending on how many things you're looking at here, 0.001, this is highly statistically significantly different. And it is clinically different as well, with most doctors in my area being very concerned and maybe even putting fear into your heart about having a high LDL. Remember, these people are deciding to do it on their own. They're not scared about it. And what's fascinating is they've, again, studied people who said they were on it for 5 years. So what did they find? The next slide shows the meat of the matter, if you will, from the study. And it's kind of a complicated slide. I'd like to go through it. It's the actual one that was presented at the meeting. On the left-hand side, remember LMHR means the keto group, the lean mass hyperresponder group. And I put a circle around the LDL values, which corresponds to that y-axis on the far left side. And the circle or oval really just shows visually that the LDL levels, the lines, were much higher than the 80 people in the Miami Heart group. So this just restates what we saw before on average. This shows the actual values. And so it's not just a few outliers, but most people were much higher on the HR group. That's the lines there. Now the bars, or the columns, show the actual total plaque score itself. And visually you can see, if you overlapped the two, they're pretty much the same. So that remember, a total plaque score of 0 means no evidence of narrowing in the coronaries. 15 different areas, 0, 1, 2, 3 is the scoring. And here, the blank basically on the bottom represents the people who had 0 total plaque. And then if you added up all of the numbers here and put them into categories, go to the next slide. This is my own slide, doing the best I could from the slide before, showing again the total plaque score is 15 sites multiplied by 0, 1, 2, 3. So the range is 0 to 45. And if you categorize people, the 42 people had a coronary total plaque score of 0, no disease at all on the far left. About 30 people had a score between 1 to 5, score 6 to 10, about 8, and then one person had a score of 13. So there was nobody who had a 16 to 20, a 21 to 50, nobody had a score above 13. Remember, the whole range here is up to 45. So if you had severe heart disease, you would have 30, 40 in the score if you had it throughout. So what we're looking at clinically is most people had no disease at all, but maybe some had mild in maybe 1 or 2 places. I suppose a score of 5 could mean that there's mild in 5 of the 15 places, or it could mean that there's severe in one and moderate in another. So the score itself doesn't give you all of the information, but to me this is reassuring that on this scale of 0 being none, 45 being maximum, there's not much disease here. Now, some people like to look at it the other way here. I just flipped the axes, and now 45 here on the far left-hand side is the maximum or highest score, and 0 is the lowest score. And so you can again see that there are about 42 people, the very bottom line going up to 42 number of subjects, have 0 as the score. 15 sites on the coronary arteries. The visual interpretation was no coronary atherosclerosis, with one person having a 13. To me, this is pretty reassuring. And remember, it's compared to the Miami Heart group of normal or healthy, people who don't have clinical atherosclerosis or disease. The next slide. Now, let's go back to that first slide, the baseline characteristics. If you look down below the LDL, where they compared the 272 to 123, there are a couple numbers that are very striking and highly statistically significant. The HDL cholesterol, remember that one? Remember the H meaning healthy, it was 90 in the people who are on keto on average, and it was only 63 for the Miami Heart. And the triglyceride, remember that in the blood? If you've heard me in the clinic, we look at triglyceride and HDL. We don't look at total and LDL so much anymore. And if you do, you want to look at the small and the large. And I'm not even sure how important that is anymore. And this study is a long-awaited look in 80 people here with HDLs of 90 on a keto diet. In my experience, HDL just keeps going up and up the longer you do a keto diet. So in some ways, this is a test of the old way and the new way. Look at the old way being, let's look at LDL, let's give you a drug for it. The new way is, let's talk about food. Let's change to healthy food, and let's not use medications if at all possible. And let's see what happens with the healthy keto lifestyle to cardiovascular risk. If you put all of these numbers in, there have been studies that have been done that the cardiovascular risk scores goes down on a low-carb diet, and that's largely because of the change right here and the HDL and the triglyceride. Remember the next slide here now showing the gestalt or the picture of the LMHR, the keto folks for 5 years. If you overlapped it over to the normal healthy Miami Heart cohort, it's basically the same. The results that Dr. Budoff gave, the matched mean age was 55.5 years with a mean means average, with an average LDL of 272, with a mean 4.7 year duration on a ketogenic diet. There was no significant difference in coronary plaque burden, that's that total plaque score as compared to Miami Heart controls. Again, this is not a randomized trial asking some people to do keto, some not to do. This was an observational study of people who self-determined that they want to do a keto diet, and they've chosen to do it despite elevations in their own LDLs. And the actual coronary artery score was 0 versus 1 for the Miami Heart, and the CCTA total plaque score, that's that 0 to 45 range score, basically was no different as well. The conclusion was no relationship of LDL elevations and plaque at baseline. So how do I put this together? What are the take-home points? These are the baseline findings. Remember, it's not the full study. This is a report of the baseline scans at the beginning of a 1-year-long study of the effects of a keto diet, not on cholesterol, but on coronary artery plaque itself. The amount of plaque at baseline here was similar to an age-matched healthy population, the Miami Heart. The keto diet for 4.7 years was self-reported. This is a limitation. I don't know why someone would lie about it. But over this next year now, the participants will have to document that they're on a keto diet, and they're going to get another scan after 1 year. And there was kind of a rolling start so that it's not all going to be done all at one time. It took a long time to get everybody in, so it's going to take a long time for that whole year for everyone to pass. It's notable that most participants had no evidence of coronary artery plaque on these baseline scans, despite the self-reported ketosis. I think that's a really important finding. And if there was some coronary plaque, it wasn't any different than a healthy, normal population. The final results comparing the baseline to the 1-year scans should be available sometime next year. Now, with the process of putting the information together, presenting it at meetings, I don't know exactly when it will be out. We're anxiously looking forward to it. These results were kind of rolled out over the last half of 2023, with the first presentation formally done in December. So hopefully we'll have another look at this similar study next year. I know Dave Feldman personally. I've helped in trying to consider what to do in a study like this, and I thank you if you are a participant in this study. You took the time and effort to go out to to LA, someplace far away, to get a scan done. These studies cannot be done without selfless people who decide to help participate in a program like this. Now, next year, if the results come in that the coronary arteries are getting clogged up, we will definitely tell you. We will say so. If there's no change, this is an important finding because everyone has predicted that there will be detrimental changes. Remember, it's dangerous to have an LDL like this, but with this HDL elevation and triglyceride reduction, I'm not so sure that there will be a problem with it going forward, but I'm not sure. This is where science will help us. So I'm hopeful that Dave Feldman and his crew, his investigative team, will be able to continue this kind of study. And I know that they're looking for more donors and more support at the Citizen Science Foundation. And I supported this study in a GoFundMe sort of platform. And I hope you want to help out and you would consider funding this ongoing study or maybe similar studies to it. Very interesting preliminary results from a very important study that sheds light on the keto metabolism, which has many differences to the keto metabolism of carb eaters and carb burners. I hope that's helpful. Press like if you like this, and be sure to subscribe so you don't miss out on further content. If you don't have my top 10 tips on how to start keto right, please look in the description below. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.